CMV reactivation is a significant problem following allogeneic stem cell transplantation. And it's usually being treated with antiviral drugs such as ganciclovir or foscarnet, but these drugs have limitations. First of all, they induce side effects. Most importantly, some patients develop resistance to the antiviral drugs, and therefore the treatment options are limited. At the past ASH meeting in Atlanta, I presented the initial results of a clinical trial that we initiated at our center by treating CMV reactivation following allogeneic stem cell transplantation. Years ago, we developed this approach by generating CMV-specific T cells by utilizing the immune system of the donor, the original stem cell donor, and make these cells specific to the protein that is derived from the CMV virus termed PP65. The way we are doing this is by using a pool of peptides that overspans the entire protein PP65. And we stimulate the T cells of the donor in the laboratory to make them specific for the antigens that are derived from the PP65 protein. This is one representative example of a patient that we treated. Here is the amount of CMV measured as antigenemia, and you see the specific T cell responses. So what this shows then is that the patient, first of all, was treated with a variety of antiviral drugs and did not respond. So the CMV remained at elevated levels. Here you can see we gave the CMV-specific T cells, and subsequently there was a rise in the CMV antigenemia to a higher level, which we in the beginning thought was a failure of the T cells, but subsequently this initial peak could be observed in every other patient treated. So at this point we consider this to be a good sign. Somewhat delayed, but thereafter we could demonstrate the CMV-specific T cell frequency coming up to maximum numbers, and while this happened, the CMV antigenemia came down and turned out to be negative and was persistently negative thereafter in this patient. This is a typical response which we observed in other patients. What this table shows is the response evaluated in a total of 13 patients, and you can see here, with the exception of one patient which cleared the CMV totally by 9 weeks following the T cell infusion, it took somewhat between 2 weeks to 8 weeks to clear the CMV infection. But at the end, in these 13 patients shown here, all the patients cleared the CMV. Based on these encouraging results, we expanded the trial to a larger phase 2 trial. As a fallout of the initial study, we also tested to administer cells from a different donor, which we call third party, by virtue of trying to match the HLA type of the CMV-specific cells with the HLA type of the recipient. So this way we can treat patients that are referred from other hospitals, and with our bank of CMV-specific T cells, we can potentially select appropriately matched T cells and administer to this patient. So I think this is the next wave of immunotherapeutic or therapeutic approaches, following transplantation.